Hey y'all, this is Rohit Verghese, back again for week 9 of QBank remediation. We're going to start off with a select all that apply question. The question is as follows. The nurse provides care for a client who had an exploratory laparotomy a day ago due to a small bowel obstruction. Upon assessment, the client reports the pain is 4 out of 10. Which action will the nurse implement? Now, I got this question completely wrong in that there were 3 answer choices that were correct, and I chose only one of them, and I also picked one wrong answer choice. So first, let's go over the answer choices. Answer choice number 1 says administer oxycodone 5 milligrams with acetaminophen 325 milligram tablets by mouth. Number 2 is prepare a dose of ketorolac 30 milligrams by IV push. Number 3 is push the patient-controlled analgesia or PCA button. Number 4 is assist the client to ambulate in the hall. Number 5 is to encourage the client to eat a high-fiber diet. And number 6 is to auscultate for bowel sounds in 4 quadrants. Now the answer choice that was completely wrong, which I happened to pick, was answer choice number 1, administering oxycodone 5 milligrams with acetaminophen 325 milligram tablets by mouth. So this client will not, the reason why this answer choice is incorrect is because this client will have an NG tube after surgery to repair a small bowel obstruction. So administering pain medication by the mouth is not going to be appropriate at this time while they have an NG tube. Now, the correct answer choices were 2, 4, and 6. I got answer choice 6, which was to auscultate for bowel sounds in 4 quadrants. And this is correct because the part of the post-op abdominal assessment is auscultation of bowel sounds. Hypoactive or absent bowel sounds may indicate formation of an ileus. The next answer choice that was correct that I did not pick was answer choice number 2, which is prepare a dose of ketorolac 30 milligrams by IV push. Now this is correct because IV pain medication such as ketorolac, which is an NSAID, is an appropriate intervention for this client's pain because they can't have anything by the mouth, so giving an IV push would be preferable. And answer choice number 4 is also correct. The answer choice number 4 reads, assist the client to ambulate in the hall. And this is correct because after we have abdominal surgery, trapped air can cause gas pains. So ambulation is the best way to help this gas to move out of the body via the rectum. And so that's why answer choices 2, 4, and 6 are correct, and number 1 are not. And number 1 is not. Moving on to the next question. This is a normal question, not a select all that apply. And the question reads, the unlicensed assisted personnel, or UAP, reports that a client scheduled for surgery has a temp of 102.5 degrees Fahrenheit, or 39.1 Celsius. Which action will the nurse take first? And so this is another prioritization question. And the answer choice that I put was answer choice number 2, notify the healthcare provider immediately. And so this is incorrect because the nurse should notify the healthcare provider of the finding after validating the accuracy of the temperature. If the temperature remains unexpectedly elevated, surgery may be delayed. So we don't immediately go to the healthcare provider at this time. The correct answer choice was answer choice number 4, which is to verify the temperature measurement. So this is correct because the nurse should first verify the client's temperature to ensure accuracy before intervening. By doing so, the nurse prevents unnecessary intervention should the reported finding be in error. Excuse me. So we want to double check that the temperature is correct before we take additional measures. We don't want to overact. And so that's why answer choice number 4 is correct. Moving on to the last question. A client has a weighted nasoenteric tube to the right nair. Prior to beginning tube feedings, the nurse notices a guide wire inside the nasoenteric tube. Which action does the nurse perform next? So the answer choice that I picked was number 3. Notify the healthcare provider immediately. This is incorrect because there is no need to identify the healthcare provider, as this is a common issue with this type of equipment. And I did not know this. The nurse may contact the healthcare provider if there are any urgent issues related to the nasoenteric tube, such as displacement or signs and symptoms of aspiration. So that's why answer choice number 3 is incorrect. Answer choice number 4 is correct because a nasoenteric feeding tube is a single lumen tube with a tungsten weighted tip. The tube is inserted through the nose into the stomach and beyond the pylorus into the small intestine. Because the tube is radiopaque, placement is confirmed with an X-ray. Once placement is confirmed, the nurse may dispose of the guide wire and begin tube feedings. So the guide wire is there to make sure that the placement of the nasoenteric tube is correct. So this is a common thing that happens, which I did not know. And with that, those are the 3 questions that I wanted to talk about for this week. I hope you guys have a great day. Thank you.